How would you briefly describe your project to someone unfamiliar with what you do?
So, our project is looking at malnutrition among older adults, and we're following older adults from hospital to home. And malnutrition is very common in older adults. 50% is an estimate, and the rate in the hospital is high as well. So, what we were trying to do, is uh, follow them home, working with a post-acute care group in the hospital through home health and then to the AAAs. And in the home, we provided them nutrition therapy for 6 months.
What is the why behind your project?
Older adults, we need to address this so they can live a more fuller life. And it's been underdiagnosed in years past, so it was time to bring this to the forefront.
What has worked well for your project?
The nutrition therapy, this was a randomized controlled trial. So for the intervention group, a registered dietitian nutritionist went into the home once a month and they reassessed and provided therapy. And we started looking at our data, and in compared to the control group, our intervention group has done stellar and improved their quality of life in many different measures and physical abilities, that type of thing.
What are some challenges your project faced?
I don't know how this would have worked, what challenges we might have had without the pandemic, but the pandemic, the communication. When you follow someone from hospital home, it's called transitions of care. That's tough on a good day. And with the pandemic, it made it really, really challenging. So that's probably, was our biggest challenge, is to keep those communication lines open, because we were going to meetings all the time physically, and then of course virtually, but not the same, and not shaking hands, not saying hi, how you doing. So I guess it boils down to communication was the biggest challenge. But again, pandemic, I think, was a big factor.
How did you find appropriate partners/partner organizations?
So we had home health agencies that were associated with the what we call the PAC, and then AAAs. I've worked with the AAAs in many situations over the years, volunteer, consulting. And then I know the folks at the Utah division level. So it was a nice flow. Those relationships had already been built. We just needed to develop them a little bit more.
What funding sources have you utilized or will you utilize?
And so the AAAs donated time and money, as did the PAC. So there was funding, but as part of the grant package.
How will this project be sustainable once your grant period is done?
Malnutrition has been kind of hard to define, and everybody had their own way of thinking about it. And in recent years, the definition has been tightened, and there's some real criteria. So we could provide this to the home health nurses and the physical therapists and the AAA folks, and they could do an aha moment saying, oh, is that really? I think Mr. So-and-so, could have this problem. So it was awareness, that number one. And then we've put together training programs so that not so much the hospital side, but the AAAs, they can utilize a dietitian more effectively. And part of the grant is to put together, I'm going to call it a manual. I think we keep changing the term, but it's a how-to. How do you connect with your dietitian? What can they do for you? That kind of thing.
What stakeholders do you need buy-in from?
So that was our hospital, the University of Utah Post-Acute Care Collaborative, which included the home health. And then we needed the AAAs. We had 4 AAAs involved. And then our state division on aging.
What advice do you have for trying to replicate a similar project?
We had a really nice design developed, and and if we were able to sit down with um, on a regular basis, not with the pandemic, and kind of go over and tease it out so that it was nurse A, nurse B, AAA director, whatever, just so you could put a name to the folks involved. I think that just like a flow chart, at work, you know how things process, and this was a new thing. So utilizing RDN was a new thing. We had a basic, but we didn't have that opportunity to really tease it out. And it's like an org chart, right? In your institution. That's a good starting point, and that's what we had. And then you have to tease it out and go, what employees are doing what, and so that you can keep the lines of communication open.
How do I get started?
You would need to make those connections. Going to your local hospital and chatting with them about malnutrition. I'll add that CMS now has added malnutrition as one of their benchmarks. So it's going to be measured now. They're going to be screening and assessing for malnutrition. So it's probably going to be easier to talk to hospital administrators, et cetera, about malnutrition. And then making the case that you have to follow those folks home. You can't treat malnutrition in 3 days, in a hospital stay, right? So you need to have adequate flow. And then you do the same thing with the home health agencies and the AAAs. And you just develop those relationships as best you can.
What do you wish you would have known prior to beginning the project?
It comes back to the training. We both almost said it simultaneously. If we had had the opportunity to go to the home health agencies and do some actual training, and not something virtually for 5 minutes or something like that, then I think that would have made a huge difference. And because again, we had a template, we had a roadmap, but we needed to fill in the blanks, and we had to have it had to be thought-provoking. Like who's on board, where are we going to shift employees, that kind of thing. So so really it would be that training, how important training is.